Here are some key points about the ongoing debate over the risks of ultra-processed foods. Ultra-processed foods are industrially formulated food-like products made from cheap, highly processed ingredients. Examples include soft drinks, chips, candy, fast food, etc. Numerous studies have linked the consumption of ultra-processed foods to increased risks of obesity, type 2 diabetes, cardiovascular disease, and other health problems. The evidence suggests these foods may be harmful to health. Critics argue that ultra-processed foods are engineered to be hyperpalatable and addictive, leading to overconsumption. The industrial processing also strips away many beneficial nutrients. However, the food industry argues that processed foods can be an affordable, convenient way for people to access nutrition. They say the health risks are overstated and that processed foods are not inherently unhealthy. There is debate over how to define and regulate ultra-processed foods. Some countries have issued guidance to limit consumption, but others have faced pushback from food companies. Experts generally recommend minimizing ultra-processed foods and focusing on whole, minimally processed foods as part of a healthy diet. But the appropriate role of processed foods in the food system remains a contentious issue. Overall, the potential health risks of ultra-processed foods is an area of active research and debate with valid arguments on both sides. More work is needed to fully understand the implications for public health. Let me dive a bit deeper into the debate around ultra-processed foods, the health concerns. Numerous large, high-quality studies have found associations between higher consumption of ultra-processed foods and increased risks of obesity, type 2 diabetes, heart disease, and other chronic diseases. The proposed mechanisms include the food's high calorie density, added sugars, unhealthy fats, and lack of beneficial nutrients like fiber. The industrial processing may also alter the food's effect on hormones and metabolism. Critics argue these foods are engineered to be hyperpalatable, triggering overconsumption and addictive-like eating behaviors. The lack of whole foods may also disrupt the gut microbiome. The industry perspective, food companies argue that processed foods can be an affordable, accessible way for people to get necessary nutrition and calories. They say the health risks are overstated. Industry groups contend that any food, even whole foods, can be unhealthy if consumed in excess. They say processed foods shouldn't be demonized. Companies also argue that processing helps extend shelf life, improve food safety, and make foods more convenient, which can be important for many consumers. Regulatory challenges. Defining ultra-processed is complex, as processing exists on a spectrum. There's debate over where to draw the line. Some countries like Brazil and France have issued dietary guidelines to limit ultra-processed foods, but the food industry has pushed back on such restrictions. In the US, the FDA does not currently have a regulatory definition for ultra-processed. Efforts to create one have faced opposition. The path forward. Many experts recommend minimizing ultra-processed foods and emphasizing whole, minimally processed options as part of an overall healthy diet. But there's also recognition that processed foods can play a role in providing nutrition, calories, and convenience for some consumers. Ongoing research, policy discussions, and consumer education will likely shape how ultra-processed foods are viewed and regulated in the years ahead. It's a complex, nuanced issue with reasonable arguments on multiple sides. Let me know if you have any other questions. There are a few potential policy solutions that have been proposed to address the health concerns around ultra-processed foods. 1. Improved food labeling and packaging regulations. Require clear, easy-to-understand labeling of ultra-processed ingredients and nutrient content. Restrict misleading marketing claims on ultra-processed food packaging. Mandate prominent front-of-package warning labels for the most unhealthy ultra-processed products. 2. Taxation and pricing policies. Implement taxes or levies on ultra-processed foods similar to taxes on sugary drinks in some places. Provide subsidies or incentives to make minimally processed, whole foods more affordable. Restrict the use of food assistance benefits for purchasing ultra-processed items. 3. Restrictions and bans ban the sale of certain categories of ultra-processed foods in schools, government buildings, or other public settings. Limit or prohibit the marketing and advertising of ultra-processed foods, especially to children. Set maximum thresholds for unhealthy nutrients like added sugars or trans fats in ultra-processed products. For public education and awareness campaigns. Fund public health campaigns to educate consumers on the health risks of ultra-processed foods. Integrate ultra-processed food education into school curricula and community nutrition programs. Partner with healthcare providers to screen for and counsel patients on ultra-processed food consumption. 5. Research and industry incentives. Invest in research to better understand the health impacts of ultra-processing. Provide incentives for food manufacturers to reformulate or develop healthier processed alternatives. Support the production and distribution of minimally processed, whole foods. The feasibility and efficacy of these policy solutions would depend on the local context and the balance struck between public health and industry interests. A multifaceted approach may be most effective. There are several key challenges in implementing policies to address the health concerns around ultra-processed foods. 1. Industry opposition and lobbying. The food and beverage industry has significant political and economic influence. They often oppose regulations or taxes that could impact their profits. Industry groups may challenge policies in court or use lobbying to water down or delay implementation. 2. Balancing public health and consumer choice. There are concerns that overly restrictive policies could limit consumer options and access, especially for lower-income populations. Policymakers must balance public health goals with preserving some degree of personal freedom and food affordability. 3. Defining and regulating ultra-processed. There is no universally agreed upon definition or standard for what constitutes an ultra-processed food. Developing clear, enforceable regulatory criteria is challenging given the spectrum of food processing. For enforcement and compliance, policies like marketing restrictions or ingredient limits require extensive monitoring and enforcement mechanisms. There may be difficulties ensuring widespread compliance, especially across diverse food retail and production settings. 5. Unintended consequences. Policies targeting ultra-processed foods could potentially lead to reformulation or substitution with other unhealthy ingredients. There are concerns about potential negative economic impacts on food industry jobs and small businesses. 6. Political and cultural resistance. Some view policies as government overreach or a threat to personal freedom and food traditions. Building public and political will for bold policy actions can be challenging, especially in the face of industry lobbying. Overall, implementing effective policies requires navigating complex trade-offs, securing sustained political support, and overcoming significant industry resistance. A phased, adaptive approach may be most feasible in many contexts. Thank you so much for joining me today. If you enjoyed this video, please don't forget to hit that like button and subscribe to my channel for more exciting content like this. Until next time.